Joining me right now via telephone, author of a very helpful book, I'm sure. It's called The Cleveland Clinic Guide to Heart Attacks. We're joined now by Curtis Rimmerman, a doctor. He is at the Cleveland Clinic, and he holds the Gus Karas Chair in Clinical Cardiovascular Medicine and has been a staff cardiologist there for the past 16 years. And Dr. Rimmerman, thanks for joining us today in Florida. How are you today?
Very well, and I really appreciate the opportunity.
It's a good chance to get to talk to you. People don't often get a chance to talk to doctors unless you go into the office, so I'm glad our audience has a chance to get some brief answers today. And this book, which I've had a chance to look through, I like the way you lay it out. It really makes it more in a layman's terms. I guess that's one of the things, Paul, you deal with. People, they have a lot of questions for you, don't they, about the heart?
Absolutely. I spend a lot of my time trying to answer those questions. I said, well, why not try to answer them on a wider scale?
Are heart attacks more prevalent now? I know the statistic, just from reading through the book, 1 million a year. Is that way up?
Well, it's interesting. The stats suggest it's relatively level, and there's two reasons for that mainly. One is there's more heart attacks in the sense that people are living longer because many advances in medicine are keeping us alive longer. And then the second thing would be that since people are living longer, we have medications that are being used, and it's really curbing some of the incidence of heart attacks. So in a way, they equal it out. The medicines help defeat the aging profile.
It used to be, not too long ago, you heard from your parents or grandparents' generation, you had a heart attack. It seemed like most people died at that moment. Now people are at least surviving them, at least the first one. Is that true?
Well, that's absolutely true. I mean, in my lifetime, not my professional lifetime, but since I've been alive, there was coronary intensive care units have been invented. So we didn't really even have telemetry or monitoring of patients. But we've come a long way, and the angioplasty, stenting, bypass surgery, and also the statin medications, in particular, lowering cholesterol and stabilizing the plaque, has been extremely helpful.
What is the biggest risk factor? Is it your diet and your lifestyle, or is hereditary part of that as well?
So I would say genetics is most likely number one. Mm-hmm. And that's on, in many respects, you can't change your genetics, but all the other risk factors are modifiable. You
can affect yourself by diet and exercise and eliminate a lot of that risk, can you?
Well, one of the things I say in the book is just because your parents have heart disease doesn't mean you're destined to have it as well, because that's only one factor. Diet, exercise, blood sugar, blood pressure, cholesterol, and tobacco use are all of the other modifiable risk factors, which often supersede genetics if done aggressively.
Treatments obviously have changed over the last 20 years. I'm sure you've had a lot of change since you became a cardiologist even to now. I guess it's on almost a daily basis. Is it a lot? I'm sure it is a lot better now, but the treatment's probably less invasive now than they used to be, right?
Well, I think it is, because as we listen to this national health care debate, I think we're all thinking about disease preemption. And when patients actually show up on your doorstep with a heart attack, in many respects, the whole system is a failure. So many of these medicines, along with the lifestyle modification efforts of patients, are reducing the incidence of heart attack. And as I said before, it's just the aging population that's experiencing more heart attacks. So these medicines, I think, are extremely helpful, again, particularly the statins, but other medicines, and don't forget aspirin is the medication in this circumstance, and one of the most important. And other important classes of meds would be beta blockers and what we call ACE inhibitors.
As a preventative, you mean?
Yes, they can be preventative, or they can be given after a patient has a heart attack. So there's a number of roles for these medications, and it's important that the patient discuss this with their physician in terms of what medicines are appropriate to preempt heart disease, what medicines are appropriate if I've been diagnosed with heart disease.
How about diet? That's probably the biggest factor most people can't control on a daily basis. Does it mean necessarily you have to cut out everything that tastes good, or can you have some of that in your diet?
Well, what I ask my patients to do is strive for a sustainable diet. And it's few individuals who can cut out everything. So if you can bat, I would say maybe an 80 to 85% success rate, meaning low fat, low cholesterol, try to reduce your calories, but occasionally recognize the birthday, the anniversary, or a special guest and going out to eat, then in my mind that's sustainable and that's a realistic plan.
Stress. There's different types of stress, positive stress and there's negative stress. Do either of those factors contribute to heart attacks?
Well, particularly the negative factor of stress, what we call a soft risk factor. One of the reasons we think it's soft is because we can't measure it. Mm-hmm. It's not like you can have your stress level measured per se on a routine basis. I'm sure there's people out there who can measure it, but it's not something that's done routinely, unlike, say, blood pressure or cholesterol or blood sugar. So certainly stress raises blood pressure. It causes what we call vasoconstriction, meaning it constricts the blood vessels. It increases the work on the heart. And when you say stress, that goes into sleep deprivation. That might mean other illnesses that are on board. So a number of factors can fall under the definition of stress, but it's not good.
In your practice, are you seeing people much more aware of their heart health now, or are they trying to take care of it better themselves?
I think there's a bimodal distribution. There are people who really don't pay attention to their health and only pay attention to it when it sends an alarming signal or sign. But there's a significant, encouraging portion of the population that are much more aware of their health in general. What I see is their heart health. They're taking positive measures and implementing them. And they're much more well-read and educated when they hit my office.
Well, that's good news. I mean, with all the information out there nowadays, internet and books like yours, Cleveland Clinic Guide to Heart Attacks, people can at least get some information now before they go to the doctor, where in the past, maybe they didn't, unless they had access to a medical library of some sort, they didn't really have as much information going in, right?
I agree with you, and I can't emphasize how beneficial that is, not only to the patient, but to the physician, because what you do when you have an educated patient who comes in your office, you can really elevate the conversation. You can use terms, you can assume that they have basic biology knowledge, and you can go beyond the basics and spend time on really more advanced topics in terms of disease preemption and what are the typical treatment options available. And us physicians are all constrained by one big factor, and it's time. So if the patient can really do their homework ahead of time, that's a big deal.
Well, this is a type of book that I'm sure our audience down here in Florida is going to be interested in. And like I said, it's laid out in a way where even if you don't have any background in medical terminology, it's going to help you. And it also gives some positive stories as well from people who survived heart attacks, which I think that's another part of the recovery factor, if you have one, is a positive attitude, right?
Absolutely. And, when you have an illness, particularly if it's sudden, attitude is so important. So it's important to have a lot of surrounding support from your family and friends, and to make plans beyond your diagnosis of heart disease, because the overwhelming majority of people live with heart disease. They don't die from it.
Cleveland Clinic Guide to Heart Attacks is the name of the book. We've been talking with Dr. Rimmerman on staff at one of the best clinics in the world for not only heart disease but all health matters. And Dr. Rimmerman, we appreciate you joining us today.
And I really appreciate your time.
Great. Thank you, Doctor. We'll talk to you soon.
Thank you. Bye-bye.